Title: Taking Amlodipine, Losartan, or Lisinopril for blood pressure. Here's what many seniors don't know. If you are over 60 and taking Amlodipine, Losartan, or Lisinopril for blood pressure, please don't skip this video. Many seniors take these medicines every single day, but they are never told the small details that can prevent dizziness, falls, swollen legs, kidney problems, and dangerous medication mistakes. Welcome to Dr. Andewala. Subscribe now, because today's video may help you use your blood pressure medicine more safely. Before we begin, one important reminder. This video is for education only. Do not stop, change, double, or skip your blood pressure medication without speaking to your doctor or pharmacist. High blood pressure is often silent, but it can still damage the brain, heart, kidneys, and eyes. The goal is not to fear your medicine. The goal is to understand it, respect it, and use it correctly. Many seniors think, I feel fine, so maybe my blood pressure is fine. But this is where the danger begins. High blood pressure usually does not create obvious symptoms. You may not feel pain, pressure, or warning signs. That is why blood pressure is often called a silent problem. By the time symptoms appear, damage may already be happening quietly inside the blood vessels. Amlodipine, Losartan, and Lisinopril are commonly used because they work well for many people. But they work in different ways. Amlodipine relaxes blood vessels by affecting calcium channels. Losartan relaxes blood vessels by blocking angiotensin receptors. Lisinopril relaxes blood vessels by blocking an enzyme called ACE. Same goal, different pathways, and different side effects. Here is the first thing many seniors don't know. The best medicine is not always the strongest medicine. It is the medicine that controls your blood pressure without making you dizzy, weak, swollen, dehydrated, or unsafe. In older adults, doctors often think carefully about balance, kidney function, other medicines, fall risk, and how the person feels day to day. If you take amlodipine and your ankles or feet swell, you are not imagining it. Swelling in the ankles, feet, or legs is a known side effect. It happens because the medicine relaxes certain blood vessels, and fluid can collect in the lower legs. This does not always mean heart failure, but new swelling should not be ignored, especially if it is painful, sudden, or only on one side. Many people make a mistake when swelling starts. They stop amlodipine suddenly, or they take a water pill without advice. Please don't do that. Call your doctor. Sometimes the dose can be adjusted, timing can be changed, or another medicine can be added or substituted. But the decision should be medical, because uncontrolled blood pressure can be more dangerous than mild swelling. If you take Lisinopril and develop a dry cough that does not go away, this can be related to the medicine. It is usually not an infection, and cough syrup may not solve it. Some people cough for weeks before realizing the connection. If this happens, do not stop on your own, but tell your doctor. In many cases, a different class like an ARB may be considered. Losartan is an ARB, and many people tolerate it well. It is sometimes used when ACE inhibitors like Lisinopril cause cough. But Losartan still needs respect. It can affect kidney function and potassium levels, especially in seniors, people with kidney disease, people taking certain water pills, or people using potassium supplements or potassium salt substitutes. One of the most important senior safety rules is this. Be careful with potassium. Many people switch from regular salt to low sodium salt or salt substitute, thinking it is automatically healthy. But many salt substitutes contain potassium. If you take Losartan or Lisinopril, too much potassium can become dangerous. Always ask your doctor or pharmacist before using salt substitutes. Another hidden risk is pain medicine. Many seniors take ibuprofen, naproxen, diclofenac, or other anti-inflammatory tablets for arthritis, back pain, knee pain, or headache. These medicines can raise blood pressure, reduce the effect of blood pressure medicines, and increase kidney risk, especially when combined with Losartan or Lisinopril. Ask before using them regularly. This does not mean you must suffer with pain. It means you need a safe pain plan. Your doctor may suggest safer options depending on your health history. The danger is not one supervised dose for everyone. The danger is taking these pills daily for weeks without telling anyone, while also taking blood pressure medicine, water pills, diabetes medicine, or kidney-related medicines. Many seniors also don't know about the sick day problem. If you are vomiting, having diarrhea, sweating heavily, not eating, or not drinking enough water, your body can become dehydrated. During dehydration, medicines like Losartan or Lisinopril may sometimes increase the chance of kidney problems or low blood pressure. This is why you should ask your doctor for sick day instructions. Dizziness is not a small issue in seniors. A young person may feel dizzy and recover quickly. But an older adult can fall, break a hip, hit the head, or lose confidence walking. If you feel lightheaded after starting or increasing Amlodipine, Losartan, or Lisinopril, especially when standing up, tell your doctor. Your blood pressure may be dropping too low at certain times. A simple habit can prevent many problems. Stand up slowly. First, sit on the edge of the bed, move your feet, take a breath, then stand while holding something stable. This is especially important at night when you wake up to use the bathroom. Low blood pressure, darkness, sleepy legs, and urgency can become a perfect recipe for a fall. Another mistake is checking blood pressure at the wrong time and panicking. One high reading after walking, arguing, drinking coffee, or rushing does not always mean failure. Sit quietly for 5 minutes. Keep your feet flat. Support your arm at heart level. Then check again. What matters most is the pattern over days, not one emotional or rushed number. Keep a blood pressure diary. Write the date, time, reading, pulse, and how you felt. Also note when you took your medicine. This gives your doctor real information. My blood pressure is high sometimes, is vague, but it is 165 in the morning before medicine and 118 after lunch with dizziness is powerful information. Patterns help doctors adjust treatment safely. Do not compare your dose with your neighbor's dose. Your friend may take 10 milligrams Amlodipine while you take 5 milligrams. Someone else may take Losartan 50 milligrams, and another person may take Lisinopril 20 milligrams. Doses depend on age, kidney function, other illnesses, other medicines, and response. The right dose is personal, not a competition. Many seniors ask, should I take my blood pressure medicine in the morning or at night? The honest answer is, it depends. Some medicines can be taken at any consistent time, but your doctor may recommend a certain schedule based on your readings, dizziness, nighttime urination, or other medicines. The most important rule is consistency and following your prescribed plan. If you forget a dose, do not automatically take 2 tablets later. Doubling can cause blood pressure to fall too low. For many blood pressure medicines, the usual advice is to take the next dose as scheduled, but instructions can vary depending on the medicine and timing. Keep a written missed dose plan from your doctor or pharmacist, especially if you live alone. Another thing many seniors don't know: alcohol can make dizziness worse. Even a small amount may increase sleepiness, imbalance, or low blood pressure in some people. If you take blood pressure medicines and notice dizziness after alcohol, take it seriously. Your body at 70 may not respond the same way it did at 40. Cold and flu medicines can also be a problem. Some decongestants can raise blood pressure or interfere with blood pressure control. Before buying over-the-counter cold tablets, sinus medicines, herbal products, or energy boosters, ask the pharmacist, is this safe with my blood pressure and my medicines? That one question can prevent many hidden problems. Now let's talk about kidney tests. If you take Losartan or Lisinopril, your doctor may order blood tests to check kidney function and potassium. This does not always mean the medicine is harming you. These tests are part of safe monitoring. The kidney and blood pressure system are closely connected, so doctors monitor numbers to make sure the medicine remains safe. Amlodipine usually does not require the same potassium monitoring as Losartan or Lisinopril, but it has its own issues: swelling, flushing, headache, tiredness, palpitations, and dizziness. If your legs swell, don't just blame age. If your heartbeat feels unusual, don't ignore it. Side effects are not a reason to panic, but they are a reason to communicate. Some symptoms need urgent attention. If you have swelling of the lips, tongue, face, or throat, trouble breathing, fainting, chest pain, weakness on one side, confusion, severe shortness of breath, or a blood pressure reading above 180/120 with warning symptoms, seek emergency help. These are not symptoms to watch at home for several days. Lisinopril can rarely cause angioedema, which means sudden swelling under the skin, often around the face, lips, tongue, or throat. This can become dangerous because it may affect breathing. Even if it happens after you have been taking the medicine for a while, treat it seriously. Stop guessing and get medical help immediately. Losartan can also rarely cause serious allergic reactions, though cough and angioedema are generally less common than with ACE inhibitors. Still, any swelling of the face, tongue, or throat is a warning sign. The safest message is simple. If breathing or swallowing feels affected, do not wait for a routine appointment. Many seniors are prescribed more than one blood pressure medicine. This is common and sometimes necessary. One medicine may not control blood pressure enough, so doctors combine medicines with different actions. But do not combine Lisinopril and Losartan unless your specialist specifically tells you. Taking an ACE inhibitor and ARB together can increase kidney and potassium risks. Medication lists matter. Keep one updated list in your wallet, one on your phone, and one at home. Include prescription medicines, vitamins, supplements, herbal products, pain tablets, eye drops, and over-the-counter items. Every time you see a doctor or pharmacist, show the list. Seniors are often treated by multiple doctors, and medication confusion is very common. Another problem is old prescriptions. Some people restart an old blood pressure medicine because they found it in a drawer. Others take a spouse's tablet because it is also for BP. Please never do this. Blood pressure medicines are not interchangeable like candy. What is safe for one person may be risky for another, especially with kidney disease, dehydration, or low pulse. What about lifestyle? Medicine works better when the daily habits support it. Reducing excess salt, staying active as safely as possible, managing weight, sleeping well, avoiding tobacco, limiting alcohol, and following a heart-friendly diet can all help. This does not mean perfection. It means small, consistent steps that make the medicine's job easier. Salt is especially important. Many seniors say, "I don't add salt," but still eat salty bread, pickles, chips, canned soup, processed meat, restaurant food, and packaged snacks. Hidden sodium can keep blood pressure high even when you take medicine daily. Start reading labels and choose lower sodium options when possible. Hydration also needs balance. Some seniors drink too little because they fear frequent urination. Others drink too much because they heard water is always good. If you have heart failure, kidney disease, or take water pills, your fluid needs may be specific. Ask your doctor what is right for you. The goal is not extreme water drinking, it is safe hydration. Let's discuss home blood pressure machines. A wrist machine may be convenient, but upper arm machines are often preferred for accuracy when used correctly. Make sure the cuff size fits your arm. A cuff that is too small or too loose can give misleading readings. Bring your machine to your clinic sometimes and compare it with the clinic device. When you check at home, don't talk during the reading. Don't cross your legs. Don't hold your arm in the air. Don't check immediately after climbing stairs. These small mistakes can change the numbers and cause unnecessary worry. A good reading technique is like good lighting for a photo. It helps you see the real picture. Another senior issue is memory. If you forget medicines, you are not careless. You need a system. Use a pill organizer, phone alarm, calendar mark, or family reminder. Take medicines with a daily routine like brushing teeth, breakfast, or bedtime, if approved by your doctor. The best medicine cannot work if it stays in the bottle. Some people stop medicine when the blood pressure becomes normal. This is a big misunderstanding. The number may be normal because the medicine is working. Stopping suddenly can allow pressure to rise again. If your readings are consistently low or you feel weak, call your doctor. The plan may need adjustment, but don't quietly stop by yourself. Many seniors also fear side effects so much that they take half doses secretly. This is understandable, but risky. Your doctor may think the full dose is not working and may add another medicine. Be honest. Say, "Doctor, I am taking half because I feel dizzy. That one sentence can prevent confusion and help create a safer plan. Family members should listen carefully too. If your parent or grandparent is taking blood pressure medicine, watch for falls, confusion, new swelling, poor appetite, dehydration, or repeated dizziness. Don't just say, "It's old age." Sometimes the medicine schedule, dose, fluid intake, or drug interaction needs review. Seniors need teamwork, not blame. Here is a simple checklist for your next appointment. What is my target blood pressure? When should I take each medicine? What side effects should I report? Do I need kidney or potassium blood tests? What pain medicine is safe for me? What should I do if I miss a dose? What should I do if I am vomiting or dehydrated? Also ask, do I still need all my medicines? This does not mean you should stop them. It means older adults should have periodic medication reviews. Weight changes, kidney changes, falls, new diagnoses, new medicines, and age itself can change what is safest. A good doctor wants to know how the treatment is affecting your real life. The biggest message today is this. Amlodipine, Losartan, and Lisinopril are not bad medicines. For many seniors, they protect the heart, brain, kidneys, and blood vessels. But safe use requires knowledge. Swollen ankles, dry cough, dizziness, kidney tests, potassium, NSAIDs, dehydration, and missed doses are not small details. They are the details that keep treatment safe. So, if you take one of these medicines, do not be afraid. Be informed. Check your blood pressure correctly. Keep a diary. Know your side effects. Avoid random pain pills and salt substitutes without advice. Stand slowly. Keep your medication list updated. And most importantly, talk to your doctor before changing anything. If this video helped you, please subscribe to Dr. Andewala, like this video, and share it with a senior family member who takes blood pressure medicine. Comment below. Are you taking Amlodipine, Losartan, or Lisinopril? And what question do you want answered next? Your comment may help us choose the next video. Before you go, remember this final line. Blood pressure medicine works best when you understand it. Don't stop it out of fear, and don't take it blindly without monitoring. Partner with your doctor, ask questions, and protect yourself from silent damage. This is Dr. Andewala, helping you stay informed, safe, and healthy. See you in the next video.